Select all to apply part 2. Nurse is assessing a client who has diabetic ketoacidosis and ketones in the urine. The nurse should expect which of the following findings. Select all that apply. So before we even look at the answer choices, we have to understand what diabetic ketoacidosis is, or DKA, and understand how the patient would present. To simplify, DKA is a diabetic complication typically seen in type 1 diabetes. Since the body has no insulin, this also means that there's no sugar in the cell. This forces the body to break down fat for fuel and results in fat waste and ketones. Ketones are very acidic, which means we have high acid in DKA, or diabetic ketoacidosis. So when you see DKA, you can use the name to help you understand the patho. So A, weight gain. Remember, the body doesn't have enough insulin, the patient has extremely high blood sugar, and the body is breaking down fat for fuel. All of this results in weight loss, so we'd expect the patient to lose weight. B, fruity odor of breath. Remember the name ketoacidosis. The body has extra ketones, and the main ketone is acetone. Yes guys, like nail polish remover acetone. This is excreted through breathing, which causes the breath to smell fruity or like a nail salon. FYI, this is also a hallmark sign of DKA. So when you see fruity breath, think DKA. C, abdominal pain. So we know the body is breaking down fat for fuel, the patient is losing weight and dehydrated. All of this can cause GI side effects, which includes nausea, vomiting, and abdominal pain. So yes, a patient with DKA may have abdominal pain. D, Kussmaul respiration. So Kussmaul presents as deep and rapid breathing. This happens when there is too much acid in the body. The body tries to get rid of the extra acid by quickly breathing out CO2, which is a primary acid in the blood. And E, metabolic acidosis. This is a given because we already know the body has a lot of acid, which means the body goes into metabolic acidosis. When you see diabetic ketoacidosis or Kussmaul breathing, know that the answer is metabolic acidosis because Kussmaul breathing is actually a sign of metabolic acidosis. The answers would be B, C, D, and E. Let me know what else you'd like me to go over. Bye.